growth, revenue growth, is also 25%. So that's how big and how rapid the expansion in the HIM industry in the Philippines is. This is also one reason why a lot of local HMOs and local insurance companies are also looking to get into this business. So they want to learn ICT and CPT so that this will help them make their services available internationally or maybe partner with international companies. So aside from having international clients, a lot of the HIM industry is also starting to service local clients. Okay, so local clients are not included in this count. Okay, this is all from abroad, from across the seas. Okay. But we have seen local companies. Even hospitals have started hiring their own HIM professionals because they wanted their code standardized. One of my classmates is the HIM head of Medical City, and what they wanted to do was develop AHR and their medical records, and then they wanted to use ICD. They also wanted to start to use CPT for their own procedures because they have already seen the advantages of using medical coding for their data. Okay, there are a lot of HIM roles. We saw a list earlier. So this is arranged by depth of knowledge. Okay, so those with very minimal healthcare knowledge can start with medical transcription. All it is having a good hearing, knowing how to type. Okay, claims processing needed a familiarity with medical coding, not much analysis. Okay, just knowing how to go through the indices of those code sets. Okay. And then there's medical coding, which aside from these skills needed, you needed an analytical brain because they must be able to analyze the charts to choose the correct codes. Okay. Parallel to that is case management. Does not need medical coding, does not need codes. This is more about using the charts in front of you and then determining, was the patient treated correctly? Was the patient given the proper medication? Okay. What they do is, after reviewing the charts, they will call the doctor and say, did you really give the patient this much, or is your documentation wrong? Things like that. So it doesn't need coding. This goes beyond coding. And then there's telemedicine. Telemedicine really involves a lot of systems people, IT people, because what they need is to set up the systems of the clinics, of the hospitals, so that they may be able to communicate with other providers, other hospitals and other doctors. And then highest in that chain is the domain of healthcare analytics. So this is a very special domain. It needs knowledge in healthcare and knowledge in IT. Okay, so this is the biggest thing right now. So if you have any interest in IT, I suggest you start learning coding and creating databases, because this is where all the data is going. Because we have generated a lot of data which are processed by all these people. Okay, what they're looking into now is, how do you use that data? How do you use all that data to improve healthcare? How do you use all that data to make healthcare more accessible to others? How do you use that data to maybe influence rules, influence laws, so that healthcare is given more equally, or maybe there would be better healthcare laws for people. So all of that will come from analyzing all those data, and that is the domain of healthcare analytics. So in this slide, all of these are available in the Philippines as jobs. Okay, the biggest bulk of that is in medical coding and in this cycle. Okay, we have thousands of people. First, they started in claims processing. Now, the medical coding industry is about to have just as many people as claims processing. Okay, but a bulk of the people with healthcare backgrounds who have shifted to the HIM career is in medical coding. Okay, locations for when you want to go into medical coding. So the big companies are in Taguig and in Ortigas. So there are a lot of companies there. There are other locations like Eastwood, Cubao, MOA, and recently they have been expanding into the second and third wave cities like Clark, Davao, and CDO. Right now, one of our trainers was deployed to Clark, okay, to train their medical coders there. So it's the industry is expanding so fast that Manila cannot cope. So they are starting to expand into other regions. Okay, let's talk about compensation. Okay, so this is 2015 data. Okay, so the salary for medical coder is around 23,000 per month. People with, because of the rapid expansion, there are a lot of companies who have started poaching coders from other companies. And we have heard of other companies offering as much as 60,000 for coders to go to their company. Okay, a medical transcriptionist earns a little bit less because they're not actually required to have healthcare knowledge. Okay, so a lot of the unemployed and underemployed nurses in since around 2010 when the retrogression started, a lot of them have founded jobs as medical coders. Okay, so that is a big bulk of the population of the medical coders have nursing backgrounds. Some of them have pharmacy, medtech, but a lot of those unemployed and underemployed in the 2010, 2013, 2014 went to medical coding, which contributed to the rapid expansion. We have the talent pool for this, and it helped the HIM industry in the Philippines to grow because they were able to find jobs for all of these people. Okay, for people to work as medical coders, they need to have a certification. So, parang doctor, you need an MD. If you go to the US, you need to take the boards there. For RNs, you need to be an RN here. If you want to work in the US, you need the NCLEX. If you want to go to the Middle East, you need the HAAD, right? Okay, so for medical coders, it's the same. Okay, so there are two credentialing bodies. AAPC is a partner of ours, so these are all certifications. So when I mentioned that those initials under my name, so I have a certification in outpatient coding, inpatient coding, and then as an instructor, and then I can opt to take these other certifications as well. These are US certifications, but it allows you to work in the Philippines. Okay, so if you have the certifications and you go to the US, you can find jobs there without taking an additional exam. Okay, because these are US certifications, so just one certification is required. Okay, so who can become a medical coder? I was talking about nurses earlier, but actually, it can be anyone with a medical background. And as I said, this is for healthcare professionals. There are actually a lot of non-healthcare professionals who want to go into medical coding. We've had students, we have a training company, as I said. We've had students who are HR professionals. We had a few who were graduates of fine arts. We had a policeman, we had seamen. Yeah. Those are the other people who want to go into medical coding. So they fall under this. Anyone willing to learn medical vocabulary and concepts. I gave you that icebreaker earlier just to show you that you know that, but you can use that in places other than the hospital, other than the clinics. So those are the things that people who have no healthcare background need to know. Lastly, anyone who is willing to be trained. It doesn't require that you are a college graduate. Okay, although a lot of companies here look for that. But in the US, medical coding is like a vocational course. Just like in the US, you can be an RN without being a BSN. Okay, it's almost the same level of competency that they are requiring. Okay, so why should people go into medical coding? So I've already told you that the certification is international. And then I also told you about the people having high salaries because of the high demand. Okay, it's a promising career path, good pay, regular office hours. That's one of the reasons why I decided to go into the corporate world instead of practicing medicine or nursing, because I wanted regular office hours. Okay, and it's also a fast-growing industry. So just like the growth of the BPO industries, right now we have CEOs and managers who are in their early 30s because they started working in the call centers right after graduation. They stuck with it, so they got promoted to managers, and now they are the head honchos of those companies. So the medical coding industry is just as fast, is just as big, and the potential is just as high. Okay, so there are a few ways to become medical coder. So you can self-study, especially you with your medical background. So it's easy to study ICD and CPD. Okay. Another way is to look for a company to hire, which is what we've been seeing right now, because a lot of companies want to invest in their own people. So aside from hiring other people, we have also started hiring people without experience and having them undergo training. You can enroll in a classroom course or an online course. Actually, these two, we have these two. These last two is part of what we offer in our business. So we have an online course and a classroom course. Just to give you an example, okay, these are the courses that we run: healthcare basics, outpatient medical coding, inpatient, and risk adjustment coding. So this is part of what we do to grow the HIM industry in the Philippines. We also have a specialized recruitment division so that we can place our students right after certification. Okay, our classroom we have our classroom course, so 9 weeks, it's a 9-week course. We also have an online course. People have 4 to 6 months access. So these are for people who have no time to go to the classroom, or maybe don't want to sit in front of an instructor all day. Okay, but I'm telling you, we had more people enrolling in the classroom course. I think this is because Filipinos are used to the classroom setup. Okay. I'm sure tinatamad sila pag online. Okay, but we have both so that we are able to grow the industry. Okay, so that's our way. That's our way of contributing to the HIM industry in the Philippines. We want people to get trained, we want them to be certified, and we want them to employ. Which is actually why we were welcome. We welcomed this invitation very much because we wanted people to know that there is life outside the hospital. So I know we all have we were all idealists when we started. We wanted to go into practice. And I still do actually. I practice part-time only to select few, because you can't really take that part away from you, right? But due to some life choices I made, I decided to go into the HIM industry. So I underwent all those. I underwent training, I underwent certification, so now I am employed. And I just wanted to tell you that there is another way for you. Of course, we welcome practitioners, clinical practitioners. That will never go out of style, right? But right now, with all our other things happening in the world, we might want to go abroad, or we might want to maybe earn more, or maybe we want to have more time spent with families instead of at work. So I'm just telling you that this is a very viable course for you, and the industry is ready to welcome healthcare practitioners. Okay, so I think this is my last slide. Yes. Okay, so do you have any questions? Yes. Precious, what a beautiful name.
Yes. So, my question is, we're talking about the medical
code that's the all the code is like do they have recognize every like the ones you said have to be numbers and
Yes.
She was asking if the codes that I showed were recognized everywhere, okay? And the answer to that is yes, as long as they have the code set. In the US, they are already accepted everywhere. In other countries, they will need to have a copy of the code set, which is also very portable. It's just a spreadsheet. So once they have that, and you give them the codes, they are able to translate that. It is also available in the Philippines, so we can also understand this. And anyone who is able to buy a book, those books can understand that.
also for nurses that are planning on going for the medical college training, do we have to be like licensed or to take the nursing license exam first?
So Precious was asking if you need to be a registered nurse to go into medical coding, and the answer is no. You just need just need to prove that you have taken anatomy and terminology, and you will be valid to take the training. It might be different when you apply with a company, because some of them, there may be some that would require that you have the RN or maybe a BSN. It's not very strict really, but there might be companies that are stricter and would require an RN or a BSN. But in general, it's not required.
Okay. Wait, I will give you a prize. Okay, so you have one who is very interested.
So in your own point of view, what really are the challenges, difficulties you usually encounter during this versus like during your past years of service?
Okay, so she was asking about the challenges. When you're a medical coder, the biggest challenge is keeping your analytical mind alive. Because when you're in the clinics, of course you're always thinking about what to give your patients, what is probably happening to them, what could you do, what could the doctor have missed. So you're very much on point when you're in the clinics. When you're in coding, there is no urgency aside from the code that you need to do. So there is a tendency to become lax in your knowledge when you are doing something comfortable. But in medical coding, you also need to keep updated. So it's basically up to you. The biggest hurdle really is keeping yourself interested. It might, unlike the clinics, medical coding I admit, it can be monotonous. Yes, because you're just looking at charts. You're not talking to patients, you're not calling doctors, you're not calling the labs, you're not running here, you're not running there. So the biggest hurdle is to keep yourself interested in what you're doing. Okay. But aside from that, there isn't really a big challenge for you to face. Maybe certification, because you also need to undergo certification in nursing. So that's another challenge. You need to be certified to work as a medical coder.
Here.
Okay, and does anyone else have questions? Yes.
Good afternoon. So you mentioned a while ago that everyone who gets to have an interaction between the patient gets to have an access with the patient data. So with the ethical consideration, how could you be able to protect the patient's privacy in terms of the divulging of those data? Thank you.
She was talking about protecting the information. In the Philippines, it's not so strict, right? In the US, they have very strict rules which are also covered under HIPAA. For example, you are in charge of bed 1, you are in charge of bed 2. You are in charge of keeping the patient from bed 1's chart away from the eyes of bed 2. You are liable. If she sees that, you have become neglectful. The doctors, let's say Dr. A cannot see the charts of Dr. B, of Dr. B's patients. So they are very strict. How they do that is that the charts are coded based on the doctors, and they are immediately translated digitally so that it will be easier to store them, and it will keep prying eyes away. For example, for certain if you have been to any of the corporations here in the Philippines, a lot of them have ID, thumbprint IDs or facial recognition for you to enter. They do that in the US, even in the hospitals. You can't just go into the medical record section and access a chart. You need to be given access. You need to have applied for the access. Sometimes you need an order from the court to access laws. That's how strict they are, which is what we have to do here. For example, like when we do our rounds, everyone knows that patient A has diarrhea. So that is not allowed in the US. So only those who are directly handling the patient can talk about the patient's problems or issues. I agree, that's a big issue, lalo na dito. And we need to be more strict more prudent with how we handle our patients' data. Questions? Thank you. Do you have any more questions? Okay, so if there are no more questions, I'd like to thank you for listening to me for maybe over an hour. I hope you, even if you don't go into medical coding, I hope that you decide to keep yourself updated in the healthcare industry. There is more to healthcare than just the clinics. And even if you go into the clinics, you will need to learn HIM so that you may be able to help your hospitals, to help your place of work, protect and organize their data. So I guess there are no more questions. So thank you. Good afternoon. Yes. Humahabol.
How accurate is the codes for the coding? What if the diagnosis is new to the what if it isn't in the handbook?
So she was asking, what if there are certain diagnoses that are not in the handbook? There are codes for that. At the end of every section, there is a certain code. It's called an unspecified code. So if you can't find the diagnosis in the whole handbook, you can use that. But there are rules for using that code. If you use that code, you have to give them a special report. A special report says, what is this diagnosis? What makes this different from the other diseases that are already here? How did the doctors manage it? Has the diagnosis been confirmed? So you can use other codes. You can use a special unspecified code for those not in the manual. But it is your job to give the burden of proof is on you. You have to give them proper documentation for it to be accepted.
I just want it to be clear, ma'am, yung question. Kasi we went out kanina. Where does nurses exactly come in this field, in this industry?
So again, I will go to US situations. Okay, so in the US, the nurses they enter the diagnosis. Okay, some of them will have software that they will already give a drop down of the most basic codes. For example, for DM there is a special code for that, but it can be expanded further into smaller pieces. So the nurse can choose just the diabetes code, but it's up to the coder to determine actually what is that very specific type of diabetes. Is it a diabetes with neurological manifestations, or maybe with kidney involvement? So as nurses, even in the Philippines, the ICD-10 has three-digit code for the diseases. But the coder can actually go as far as 5, and in the US up to 7 digits for codes. sorry, in psych, psychiatrists use ICD-10. Yes. So they must know that. Not even psych nurses. No, encoding is just entering data. Coding is analyzing the data and then choosing the numerical or alphanumeric equivalent. Okay. So that's different. Okay, and more questions? Sino bang mahilig sa ID dito? Okay, wala na hahabol. Okay, so with that, I bid you good afternoon, good luck. Mahirap yung exam, matulog kayo. Matulog kayo, that is the biggest problem sa exam. Don't go to the exam not having slept the last 3 days. Diba? Sayang yung pinag-aralan. Because you will be sleepy. So, yes. Okay. Yes, sir.
I'm just asking about if you are interested to enroll in that specific course, more or less how much would be the expenses?
Okay. So, they're talking about costs now. Okay. So, in the Philippines, the cost for a certification, sige, I'll break it down. So, the cost of the certification is $500. The exam is $500. The manuals are around $200. So 700 times 4, that's 28,000. So the cost of the training is maybe around that area, okay, depending on if you choose a classroom training or an online training. The online training is cheaper, maybe $600, because there is no investment in the facility, in the trainer. So it's a bit more expensive, maybe a total of maybe 70 to 80,000 pesos if you convert it to pesos. Okay, in the US, the coding course is around $2,000. So, a bit, just the course. So they need to pay $500 for the exam, they need to buy their own book, so maybe around $3,000 for the course. It's definitely cheaper to study here. And let me tell you, sir, and the students, you can, with the salaries that they have been getting, they will be able to recoup that investment within a year.
Within 4 months.
Okay, so are there any more questions?
Final call. Thank you, liya ka sila kanina.
At hindi lang masyadong maintindihan. Does that mean that someday we will be disregarding the paper medical chart? Kasi parang...
Okay, so I think eventually, even right now, some companies go what they call paperless. But I think in the medical side, we would still need some type of paper just for easy documentation. Okay, but the trend is after you write it down, you immediately have to have it converted digitally because they have to be stored digitally. And then the paper copies are discarded ethically. Okay, right now there are still, I have coded some charts that are still handwritten, some hindi na basahin, di ba? Okay, so, but even them, they have to, right now, we are seeing less of that because they don't get paid if you submit it na handwritten. So you can't submit it handwritten, you'll be denied, you won't get paid. So you'll need to digitize it eventually. Does that answer your question?
Miss Liza Alcances, thank you for that wonderful talk. And for sharing us that there are other opportunities outside the hospital setting.
So we'll now proceed to the awarding of the certificate. May I call on Mr. Makalata, Mr. Oswell, and Anjanette De Leon, and also the guest speaker to come up in front. Okay, so Central Escolar University School of Nursing Manila, Manila awards the Certificate of Appreciation to Liza Alcances for having been the speaker of the Integrated Seminar 2016 with the theme Creating Innovations in Nursing Practice through Integration of New Knowledge and Information, given this 15th day of January 2016 at LH Seminar Room. Signed by Josh Aaron Osabel, Overall Student Chairperson, Anjanette De Leon, Overall Faculty Chairperson, Percy Ivers, LOE, School of Nursing, and Maria Cristina Liza, University President and Chief Academic Officer. Once again, let's give her a round of applause.
Thank you.
Thank you, ma'am.